Today we are going to talk about epinephrine for allergic reactions. This is one of the most important emergency medications nursing students need to understand because epinephrine can save a life during anaphylaxis. Anaphylaxis is a severe, life-threatening allergic reaction. It can happen quickly, and it can affect the airway, breathing, circulation, skin, and gastrointestinal system. You may see anaphylaxis happen after a food exposure, medication, insect sting, latex exposure, contrast dye, or sometimes from an unknown trigger. The most important thing to remember right away is this. Epinephrine is the first-line medication for anaphylaxis. Not diphenhydramine, not steroids, not albuterol alone. Epinephrine is the priority medication when anaphylaxis is suspected. In this video, we are going to break epinephrine down step by step in simple language. We will talk about why epinephrine is used, how it works, what allergic reactions look like, important side effects, major warnings, nursing responsibilities, lab monitoring, patient teaching, and what findings should be reported to the provider. And throughout the video, I will include pop test questions to help you think like a nurse. Let's start with the basics. Epinephrine is also called adrenaline. Adrenaline is a hormone the body naturally makes during stress. You may have heard of the fight-or-flight response. That is the body's emergency response system. When the body senses danger, adrenaline helps increase heart rate, tighten blood vessels, raise blood pressure, and open the airways. As a medication, epinephrine is used in several emergency situations. For this video, we are focusing on epinephrine for severe allergic reactions, especially anaphylaxis. Epinephrine is considered a sympathomimetic medication. Sympathomimetic means it mimics the sympathetic nervous system. The sympathetic nervous system is the fight-or-flight system. A simple memory tip is, epinephrine energizes emergency response. It helps the body respond quickly when an allergic reaction is threatening breathing and circulation. Pop test question. Epinephrine is also known as what? A. Adrenaline. B. Insulin. C. Heparin. D. Diphenhydramine. The correct answer is A. Epinephrine is also called adrenaline. Now let's talk about allergic reactions. An allergic reaction happens when the immune system overreacts to something it sees as a threat. That trigger is called an allergen. Common allergens include peanuts, tree nuts, shellfish, milk, eggs, wheat, soy, bee stings, wasp stings, medications, latex, and contrast dye. A mild allergic reaction may cause itching, sneezing, watery eyes, runny nose, or a small area of hives. Anaphylaxis is more serious. Anaphylaxis can involve multiple body systems and can become life-threatening very quickly. Signs and symptoms may include hives, flushing, itching, swelling of the lips, tongue, face, or throat, trouble breathing, wheezing, chest tightness, coughing, hoarse voice, difficulty swallowing, dizziness, fainting, fast heart rate, low blood pressure, nausea, vomiting, diarrhea, abdominal cramping, anxiety, or a feeling of doom. The scariest symptoms are airway, breathing, and circulation problems. Airway swelling can block airflow. Bronchospasm can make it hard to breathe. Low blood pressure can lead to shock. Shock means the body is not getting enough blood flow and oxygen to the organs. Memory tip. Anaphylaxis attacks airway, breathing, and circulation. Airway, breathing, circulation. A, B, C. Pop test question. Which finding is most concerning for anaphylaxis? A. Throat swelling and trouble breathing. B. Mild itchy eyes only. C. One sneeze. D. Dry skin only. The correct answer is A. Throat swelling and trouble breathing may indicate anaphylaxis and require emergency treatment. Now let's talk about why epinephrine is the priority medication. During anaphylaxis, several dangerous things can happen at once. Blood vessels widen and become leaky. This can cause low blood pressure and swelling. Airway tissues can swell. The muscles around the airways can tighten. This can cause wheezing and shortness of breath. The heart may beat faster as the body tries to compensate. Epinephrine helps reverse these life-threatening effects. It tightens blood vessels, which helps raise blood pressure and reduce swelling. It relaxes muscles around the airways, which helps breathing. It supports heart function. It helps reduce further release of allergic chemicals from immune cells. This is why epinephrine is the first-line treatment for anaphylaxis. Antihistamines like diphenhydramine may help itching and hives, but they do not work fast enough or strongly enough to treat airway swelling or shock. Corticosteroids like methylprednisolone may help reduce inflammation later, but they are not immediate rescue medications. Albuterol may help wheezing, but it does not treat low blood pressure or throat swelling. Epinephrine treats the life-threatening parts of anaphylaxis. Memory tip: Benadryl helps hives, but Epi saves lives. Pop test question: which medication is first line for anaphylaxis? A. Epinephrine. B. Diphenhydramine. C. Loratadine. D. Prednisone. The correct answer is A. Epinephrine is the first-line medication for anaphylaxis. Now let's talk about how epinephrine works. Epinephrine stimulates adrenergic receptors. The main receptors nursing students should know are alpha-1, beta-1, and beta-2 receptors. Alpha-1 stimulation causes vasoconstriction. Vasoconstriction means blood vessels tighten. This helps raise blood pressure and reduce swelling in the airway. Beta-1 stimulation affects the heart. It increases heart rate and contractility. Contractility means how strongly the heart squeezes. This can help support circulation during shock, but it can also cause palpitations and increase cardiac workload. Beta-2 stimulation helps relax bronchial smooth muscle. This opens the airways and helps reduce wheezing and bronchospasm. Beta-2 effects can also reduce release of some allergic mediators from mast cells. Let's simplify that. Alpha-1 tightens blood vessels. Beta-1 boosts the heart. Beta-2 opens the lungs. Memory tip: Epi does three big things: tightens vessels, boosts heart, opens lungs. That is the core mechanism for anaphylaxis. Pop test question: which epinephrine effect helps open the airways? A. Beta-2 stimulation. B. Platelet destruction. C. Insulin replacement. D. Antibiotic activity. The correct answer is A. Beta-2 stimulation relaxes bronchial smooth muscle and helps open the airways. Now let's talk about routes of epinephrine for allergic reactions. For anaphylaxis, epinephrine is most commonly given intramuscularly, also called IM. The recommended IM site is the outer middle thigh, also called the lateral mid-thigh or vastus lateralis area. Why the thigh? Because IM epinephrine into the thigh is absorbed quickly and reliably. In community settings, patients often use an epinephrine autoinjector. Common examples include EpiPen and other generic autoinjectors. There is also an FDA-approved epinephrine nasal spray for certain patients who meet the product criteria, but nursing students should still be very familiar with autoinjectors and IM epinephrine because they are widely used. In the hospital, epinephrine may be given IM for anaphylaxis. IV epinephrine may be used in severe cases or cardiac arrest, but IV epinephrine is high risk and requires careful monitoring, correct concentration, and appropriate setting. This is extremely important. Do not confuse epinephrine concentrations or routes. A dose used IM for anaphylaxis is not the same as an IV infusion concentration or a cardiac arrest dose. Epinephrine errors can be dangerous. Pop test question: for anaphylaxis, IM epinephrine is commonly given in which site? A. Outer mid-thigh. B. Earlobe. C. Abdomen only. D. Inside the wrist. The correct answer is A. IM epinephrine for anaphylaxis is given in the outer middle thigh. Now let's talk about timing. When anaphylaxis is suspected, epinephrine should be given promptly. Delaying epinephrine can increase the risk of poor outcomes. This is one of the biggest nursing safety points. Sometimes people delay because they are unsure. They may think, maybe it is just hives. But if the patient has signs of airway swelling, trouble breathing, wheezing, low blood pressure, fainting, or involvement of multiple body systems, think anaphylaxis. Epinephrine should not be delayed while waiting for antihistamines or steroids to work. In some cases, a second dose may be needed if symptoms continue or return. Patients with autoinjectors are often taught that a second dose may be given after several minutes if symptoms do not improve or return, depending on their emergency action plan and product directions. After epinephrine is used, emergency medical care is still needed. Do not give epinephrine and then assume the event is over. Anaphylaxis can return after symptoms improve. This is called a biphasic reaction. Biphasic means two phases. The patient may improve, then symptoms can come back later. That is why observation and follow-up care matter. Pop test question. A patient uses an epinephrine autoinjector for anaphylaxis and feels better. What should happen next? A. They should still seek emergency medical care. B. They should drive home alone and sleep. C. They should ignore the reaction. D. They should take extra allergy pills only. The correct answer is A. After epinephrine is used for anaphylaxis, emergency evaluation is still needed because symptoms can return. Now let's talk about side effects of epinephrine. Epinephrine activates the fight-or-flight system. So many side effects feel like adrenaline. Common side effects include fast heartbeat, palpitations, anxiety, nervousness, restlessness, shakiness, tremor, sweating, dizziness, headache, nausea, vomiting, weakness, and pale skin. A patient may say, "My heart is racing," or "I feel shaky." That can happen after epinephrine. These effects can feel scary, but in anaphylaxis, the benefits of epinephrine are greater than the risk of these temporary side effects. Epinephrine can also raise blood pressure. In patients with heart disease, hypertension, arrhythmias, or hyperthyroidism, epinephrine may require close monitoring. But here is the key point. There is no absolute contraindication to epinephrine when anaphylaxis is life-threatening. That means if the patient is having anaphylaxis, epinephrine should not be withheld just because the patient is older or has heart disease. The provider may monitor carefully, but untreated anaphylaxis can be fatal. Pop test question. Which side effect is common after epinephrine? A. Tremors and palpitations. B. Permanent hearing loss in every patient. C. Low heart rate only. D. Complete sedation. The correct answer is A. Epinephrine commonly causes tremors, anxiety, sweating, and palpitations. Now let's talk about serious adverse effects. Serious adverse effects are more likely with incorrect dosing, IV administration errors, excessive dosing, or high-risk patients. Epinephrine can cause severe hypertension, chest pain, abnormal heart rhythms, myocardial ischemia, and in rare cases, serious cardiac complications. Myocardial ischemia means the heart muscle is not getting enough oxygen. That is why monitoring is important after epinephrine, especially in older adults or patients with cardiovascular disease. However, again, in true anaphylaxis, epinephrine is still the medication that saves lives. Do not let fear of side effects delay appropriate treatment. The bigger danger in anaphylaxis is not giving epinephrine soon enough. Another important safety point is injection site injury. Auto-injectors should be used correctly. The injection is given into the outer thigh. The leg should be held firmly, especially in children, to reduce injury from movement during injection. Do not inject into fingers, hands, feet, or buttocks. Accidental injection into fingers or hands can reduce blood flow to that area, because epinephrine causes vasoconstriction. If accidental injection occurs, medical evaluation is needed. Pop test question. Why should epinephrine autoinjectors not be injected into fingers or hands? A. Epinephrine can cause strong vasoconstriction and reduce blood flow. B. It makes the medication work better. C. Fingers absorb it faster than the thigh. D. It prevents anaphylaxis from returning. The correct answer is A. Accidental injection into fingers or hands can reduce blood flow and requires medical evaluation. Now let's discuss major warnings and black box warnings. Epinephrine does not have the same type of classic boxed warning that some other high-risk medications have, but it has major warnings that nursing students must know. First, epinephrine should be used with emergency medical care for anaphylaxis. It is not a replacement for emergency evaluation. Second, it should be given by the correct route, dose, and concentration. Medication errors with epinephrine can be serious. Third, epinephrine can worsen chest pain, arrhythmias, or severe hypertension, especially in patients with cardiovascular disease. But in life-threatening anaphylaxis, epinephrine is still indicated. Fourth, some epinephrine products may contain sulfites as preservatives. Sulfites can cause allergic-type reactions in some sensitive patients. But the presence of sulfites should not prevent epinephrine use in anaphylaxis, because the emergency benefit is greater than the theoretical risk. Fifth, epinephrine autoinjectors can cause injection-related injuries if used incorrectly, especially if a child moves during injection. Hold the leg firmly. Sixth, inspect the medication. Autoinjector solution should not be discolored or contain particles. Patients should check expiration dates and replace expired devices. Now let's talk about nursing responsibilities before giving epinephrine. In an emergency, assessment and action happen quickly. First, assess airway. Is there throat swelling, tongue swelling, hoarse voice, difficulty swallowing, stridor? Stridor is a high-pitched sound that can occur with upper airway obstruction. Second, assess breathing. Is the patient wheezing, short of breath, coughing, using accessory muscles? Is oxygen saturation dropping? Third, assess circulation. Check blood pressure, heart rate, skin color, capillary refill, dizziness, fainting, or signs of shock. Fourth, assess skin and GI symptoms. Hives, flushing, itching, swelling, vomiting, diarrhea, and abdominal cramping can support the diagnosis. Fifth, identify the trigger if possible, but do not delay treatment to figure it out. Sixth, call for help. In the hospital, activate rapid response or emergency protocols. In the community, call emergency medical services. Seventh, give epinephrine promptly according to order, protocol, or autoinjector instructions. Eighth, remove the allergen if possible. For example, stop an IV medication that is causing the reaction, but do not delay epinephrine if the patient is unstable. Pop test question. What is the priority nursing assessment in suspected anaphylaxis? A. Airway, breathing, and circulation. B. Favorite food. C. Hair length. D. Shoe size. The correct answer is A. Anaphylaxis can rapidly affect airway, breathing, and circulation. Now let's talk about nursing responsibilities after giving epinephrine. After epinephrine is given, reassess airway, breathing, and circulation. Is throat swelling improving? Is wheezing improving? Is oxygen saturation improving? Is blood pressure improving? Is the patient less dizzy or faint? Monitor vital signs closely. Monitor heart rate, blood pressure, respiratory rate, oxygen saturation, and level of consciousness. Be prepared for additional interventions. The patient may need oxygen, IV fluids, bronchodilators, antihistamines, corticosteroids, or additional epinephrine, depending on the clinical situation and provider orders. If symptoms do not improve or return, another epinephrine dose may be needed according to protocol or provider order. Monitor for biphasic reaction. Again, symptoms can return after initial improvement. Document carefully. Document the time symptoms started, suspected trigger, assessment findings, epinephrine dose, route, site, time given, patient response, vital signs, and any additional medications or interventions. If an autoinjector was used, keep the used device safely for emergency personnel if appropriate, or follow facility policy. Pop test question. After giving epinephrine, what should the nurse monitor closely? A. Airway, breathing, circulation, vital signs, and symptom return. B. The patient's favorite TV show. C. Hair texture. D. Shoe size. The correct answer is A. The nurse must reassess the patient's response and monitor for worsening or returning symptoms. Now let's talk about lab monitoring. In an emergency allergic reaction, epinephrine does not require a routine medication blood level. There is no everyday epinephrine level that nurses check after giving an autoinjector. The most important monitoring is clinical: airway, breathing, circulation, vital signs, oxygen saturation, mental status, and symptoms. In the hospital, providers may order labs depending on severity. A serum tryptase level may be ordered after suspected anaphylaxis in some cases to help support the diagnosis, but treatment should never wait for this lab. Other labs may include complete blood count, metabolic panel, blood gas, lactate, cardiac enzymes, or other tests depending on the patient's condition. If the patient has chest pain after epinephrine or has significant cardiac history, ECG monitoring may be important. Blood glucose and potassium can also shift with epinephrine effects, especially in certain clinical situations, but that is not the main focus during first-line emergency treatment. For nursing students, remember, do not wait for labs to treat anaphylaxis. Anaphylaxis is a clinical emergency. Pop test question. Should epinephrine for anaphylaxis be delayed while waiting for lab results? A. No. B. Yes. C. Only if the patient has hives. D. Only if the patient is awake. The correct answer is A. Anaphylaxis is treated based on clinical signs. Epinephrine should not be delayed for labs. Now let's talk about patient teaching for epinephrine autoinjectors. Patients at risk for anaphylaxis may be prescribed epinephrine autoinjectors. Teach patients to carry their epinephrine with them at all times. Not in the car on a hot day. Not at home in a drawer. With them. Anaphylaxis can happen unexpectedly. Teach patients to know their triggers and avoid them when possible. For food allergies, read labels carefully. Ask about ingredients. Be cautious with cross-contamination. For insect sting allergies, avoid walking barefoot outdoors. Use caution around trash cans and flowering plants, and follow allergist guidance. For medication allergies, wear medical alert identification and tell all healthcare providers. Teach patients when to use epinephrine. Use it for symptoms of anaphylaxis, such as trouble breathing, throat swelling, tongue swelling, wheezing, repeated vomiting after allergen exposure, dizziness, fainting, or symptoms involving multiple body systems. Teach patients not to wait until symptoms are severe. When in doubt during a known severe allergy reaction, use the epinephrine and call emergency services according to their action plan. Pop test question. Where should patients at risk for anaphylaxis keep their epinephrine? A. With them and easily accessible. B. Locked far away in a basement. C. Only in a hot car. D. Only at a friend's house. The correct answer is A. Epinephrine should be available quickly because anaphylaxis can progress rapidly. Now let's teach how to use an autoinjector in simple terms. Always follow the specific device instructions because different brands may vary. But general teaching often includes these steps. First, remove the autoinjector from the carrier tube or case. Second, remove the safety cap according to the device instructions. Third, place the injector against the outer middle thigh. It can usually be given through clothing if needed. Fourth, press firmly and hold it in place for the time specified by the device instructions. Some devices say hold for 3 seconds. Some older instructions may say longer. Always follow the specific product directions. Fifth, remove the device and massage the area if instructed. Sixth, call emergency services or have someone call. Seventh, monitor symptoms. If symptoms continue or return, a second dose may be needed according to the emergency action plan. Teach patients to practice with a trainer device if available. A trainer has no needle and no medication. Practice builds confidence. Teach caregivers, school staff, family members, and co-workers when appropriate. A person having anaphylaxis may be too sick to give it to themselves. Memory tip. Outer thigh, press, hold, call. Pop test question. Can an epinephrine autoinjector usually be given through clothing if needed? A. Yes, into the outer thigh. B. No, never. C. Only into the hand. D. Only into the abdomen. The correct answer is A. Autoinjectors are designed for use in the outer thigh and can often be given through clothing in an emergency. Now let's talk about storage and safety. Epinephrine autoinjectors should be stored at room temperature according to product instructions. They should be protected from extreme heat and cold. Do not leave them in a hot car. Do not freeze them. Patients should check the expiration date. Expired epinephrine may be less effective. Patients should also inspect the solution if the device has a viewing window. If the liquid is discolored or has particles, it should be replaced. Teach patients to keep 2 doses available if prescribed or recommended, because some reactions need a second dose or one device may malfunction. Teach patients not to put fingers over either end of the autoinjector. This helps prevent accidental injection. Teach them to hold a child's leg firmly during injection to prevent injury. Teach them to dispose of used devices safely in a sharps container or give them to emergency personnel according to local guidance. Now let's talk about what findings should be reported to the provider. Report any use of epinephrine. If a patient needed epinephrine, that means they had a serious allergic reaction or suspected anaphylaxis. Report airway symptoms. This includes throat tightness, tongue swelling, hoarse voice, stridor, or difficulty swallowing. Report breathing symptoms. This includes wheezing, shortness of breath, persistent cough, low oxygen saturation, or respiratory distress. Report circulation symptoms. This includes low blood pressure, dizziness, fainting, rapid heart rate, weak pulse, or signs of shock. Report symptoms that continue after epinephrine. Report symptoms that return after improvement. Report chest pain, severe headache, severe hypertension, abnormal heart rhythm, or fainting after epinephrine. Report accidental injection into fingers, hands, feet, or other unintended sites. Report if the patient has used an expired autoinjector or does not have access to replacement epinephrine. Report if the patient has repeated allergic reactions or unclear triggers. They may need allergist evaluation, updated action plan, or additional teaching. Pop test question. Which findings should be reported after epinephrine use? A. Chest pain or abnormal heart rhythm. B. Mild nervousness only that quickly resolves. C. Patient says the device made a click sound. D. The patient wants water. The correct answer is A. Chest pain or abnormal heart rhythm after epinephrine should be reported and monitored closely. Now let's walk through a clinical scenario. You are caring for Ms. Rivera, who is receiving an IV antibiotic. A few minutes after the antibiotic starts, she says, "My throat feels tight." You notice hives on her chest. Her lips are swelling. She starts wheezing. Her blood pressure drops to 82/50. What should you think? This is anaphylaxis until proven otherwise. What should you do? Stop the suspected trigger if it is safe to do so, such as stopping the IV antibiotic. Call for help. Assess airway, breathing, and circulation. Prepare to give IM epinephrine according to protocol or provider order. Provide oxygen and support breathing. Prepare IV fluids as ordered. Monitor vital signs closely. Do not wait for diphenhydramine to work. Do not wait for steroids to work. Do not leave the patient alone. Epinephrine is the priority medication. Here is another scenario. A student nurse says, "The patient only has hives, but no breathing problems. Should we give epinephrine?" This is where assessment matters. Hives alone may be a mild allergic reaction, depending on the situation. But hives plus airway symptoms, breathing symptoms, low blood pressure, fainting, severe GI symptoms, or multiple body systems may suggest anaphylaxis. Nurses must assess the whole patient. Ask about throat tightness, voice changes, swallowing, breathing, wheezing, dizziness, nausea, vomiting, diarrhea, and exposure history. If anaphylaxis is suspected, epinephrine is first line. When unsure in a clinical setting, get help immediately. Here is another scenario. A patient with a peanut allergy uses their epinephrine auto-injector at a restaurant after developing throat swelling and wheezing. They feel better after 5 minutes and say, "I think I can just go home." What should you teach? They still need emergency medical evaluation. Symptoms can return. They may need additional monitoring or treatment. A second dose may be needed if symptoms return or do not fully improve. Feeling better does not mean the reaction is over. Now let's compare epinephrine with other allergy medications. Epinephrine is first line for anaphylaxis. Diphenhydramine is an antihistamine. It may reduce itching and hives, but it does not reverse shock or airway swelling fast enough. Loratadine and cetirizine are also antihistamines, usually used for everyday allergy symptoms, not emergency anaphylaxis. Corticosteroids like prednisone or methylprednisolone reduce inflammation, but they take longer to work and are not first-line rescue therapy for anaphylaxis. Albuterol can help bronchospasm and wheezing, but it does not treat low blood pressure or throat swelling. IV fluids may help support blood pressure during shock, but they do not replace epinephrine. So the nursing school takeaway is simple. For anaphylaxis, epinephrine first. Other medications may be added, but they are not substitutes. Now let's review the nursing school must-know points. Epinephrine is also called adrenaline. It is a sympathomimetic medication. It is the first-line treatment for anaphylaxis. Anaphylaxis is a life-threatening allergic reaction that can affect airway, breathing, circulation, skin, and the GI system. Common triggers include foods, medications, insect stings, latex, and contrast. Epinephrine stimulates alpha-1, beta-1, and beta-2 receptors. Alpha-1 tightens blood vessels, raises blood pressure, and reduces swelling. Beta-1 increases heart rate and contractility. Beta-2 opens the airways and helps reduce bronchospasm. For anaphylaxis, epinephrine is commonly given IM in the outer mid-thigh. Do not delay epinephrine for antihistamines, steroids, or labs. After epinephrine, the patient still needs emergency medical care and monitoring. Symptoms can return in a biphasic reaction. Common side effects include anxiety, tremors, palpitations, sweating, headache, dizziness, nausea, vomiting, and pale skin. Serious side effects can include severe hypertension, chest pain, and arrhythmias. But in true anaphylaxis, epinephrine should not be withheld because untreated anaphylaxis can be fatal. Patient teaching includes carrying epinephrine, knowing triggers, recognizing anaphylaxis, using the autoinjector correctly, calling emergency services, storing properly, checking expiration dates, and keeping replacement devices available. Memory tip: Epi saves lives, tightens vessels, boosts heart, opens lungs. Now let's finish with 5 true or false review questions. Question 1. True or false? Epinephrine is the first-line medication for anaphylaxis. The correct answer is true. Rationale: epinephrine treats the life-threatening airway, breathing, and circulation problems of anaphylaxis. Antihistamines and steroids may be added, but they do not replace epinephrine. Question 2. True or false? Diphenhydramine should be given before epinephrine in anaphylaxis. The correct answer is false. Rationale: diphenhydramine may help itching or hives, but epinephrine is the priority medication for anaphylaxis. Delaying epinephrine can be dangerous. Question 3. True or false? IM epinephrine for anaphylaxis is commonly given in the outer mid-thigh. The correct answer is true. Rationale: the lateral mid-thigh is recommended because it provides rapid and reliable absorption for intramuscular epinephrine. Question 4. True or false? After using an epinephrine autoinjector, the patient should still seek emergency medical care. The correct answer is true. Rationale: symptoms can return after initial improvement, and the patient may need monitoring, additional epinephrine, oxygen, fluids, or other treatment. Question 5. True or false? Common epinephrine side effects can include tremors, palpitations, anxiety, sweating, and headache. The correct answer is true. Rationale: epinephrine activates the sympathetic fight-or-flight response, so these side effects can occur. In anaphylaxis, the benefits usually outweigh these effects. And that is your beginner-friendly nursing pharmacology review of epinephrine for allergic reactions. Remember, anaphylaxis can progress quickly. Always think airway, breathing, circulation. Epinephrine is first line. The outer thigh is the key IM site. Do not delay epinephrine for antihistamines, steroids, or lab results. After epinephrine, continue monitoring and get emergency care because symptoms can return. As a nurse, your job is to recognize anaphylaxis early, act quickly, give the medication safely, reassess the patient, teach clearly, and report concerning findings immediately. Thank you for watching, and I'll see you in the next nursing pharmacology lesson.